Diabetes silently weakens kidneys every day. Welcome to the Senior Health Channel. If you have diabetes, or if someone in your family over 60 has diabetes, this video may help you avoid kidney failure. In the future, many people think, my blood sugar is fine, I don't feel much pain or fatigue, my kidneys must be healthy. But the truth is, the kidneys don't complain of pain, they don't give early warnings. And by the time you discover the problem, part of your kidney is already permanently lost. In today's video, I will help you understand why high blood sugar silently damages the kidneys, early signs that are easily overlooked, and most importantly, what to do to protect your kidneys starting today, even if you have had diabetes for many years. Watch until the end, because every minute of this video can help you save many more years of healthy kidneys. 1. Diabetes and kidney disease. Why are the kidneys always the first to suffer? Understand these 5 important factors. First, the true role of the kidneys. Why are they the first to suffer? The kidneys are not just the organs that produce urine, as many people think. In fact, the kidneys are one of the hardest working organs in the body. Every day, the 2 kidneys must filter hundreds of liters of blood, remove toxic metabolic waste products, regulate the levels of water, salt, potassium, and calcium, maintain a stable internal environment for the heart, brain, and other organs to function normally. To do this, the kidneys use millions of tiny glomeruli. Each glomerulus is a cluster of extremely thin capillaries, structured like a sophisticated filter mesh. Because they are so delicate and fragile, glomeruli are very sensitive to changes in the blood. And of all the harmful factors, persistently high blood sugar is the most dangerous destroyer. It doesn't attack violently, it doesn't cause immediate pain, but it gradually damages even the smallest structures of the kidneys. That's why in people with diabetes, the kidneys are often the first and most severely damaged organ, even when the patient hasn't felt anything unusual yet. Secondly, high blood sugar destroys the kidneys through 3 main mechanisms. Mechanism 1, increased filtration pressure in the glomeruli. When blood sugar is persistently high, the concentration of glucose in the blood increases. The blood becomes thicker. The flow rate and pressure of blood through the glomeruli increase continuously. This forces the glomeruli to filter more than normal, work in an overloaded state, 24/7. To put it simply, a water filter operating continuously under high pressure. Initially, it still works well, but over time, the parts wear out much faster than originally designed. The same applies to the kidneys. Prolonged high filtration pressure tires the glomeruli. Capillaries become dilated and weakened. Damage begins to form even though the patient may not feel it. Mechanism 2, vascular wall damage, protein leakage. High blood sugar not only increases pressure, but also thickens the capillary walls, loses their natural elasticity, causes the glomerular filtration pores to dilate abnormally. The consequences: substances that should be retained in the blood, especially protein, begin to leak into the urine. This is the cause of foamy urine. The dangerous foamy urine is not painful. It does not cause discomfort. It does not immediately affect daily life. Many people think it's because of strong urination. It's because the urine is concentrated. It's nothing to worry about. But in reality, proteinuria is a very early sign of glomerular damage, especially in people with diabetes. Mechanism 3, inflammation and fibrosis of the glomeruli, irreversible damage. When the above 2 mechanisms persist for many years, silent inflammatory reactions occur in the kidney tissue. The body attempts to repair, but instead creates fibrous tissue. Healthy kidney tissue is gradually replaced by fibrous tissue that is no longer functional. Result: the glomeruli become fibrotic. Once fibrotic, irreversible, the number of functioning glomeruli gradually decreases. This is the key reason diabetes kidney disease cannot be completely cured. Progression can only be slowed if detected early enough. Third, why does diabetic kidney disease progress silently? Unlike heart or brain disease, Heart disease can cause chest pain. Brain disease can cause paralysis or facial asymmetry. Kidney disease rarely causes pain in the early stages. In the early years, urination remains normal. No fever, no obvious back pain. The body is able to use the remaining glomeruli to compensate, maintain the ongoing damage. This silence leads patients to be complacent, believe that everything is fine, miss the golden period for early intervention. Fourth, early signs are often overlooked, but extremely important. Persistent fatigue. Fasting due to kidney disease is different from age-related fatigue. Causes: waste buildup in the blood, reduced production of hormones that stimulate red blood cell production, mild anemia, tissues and brain lack oxygen. Characteristics: tired all day, not feeling well even after sleeping. Rest does not significantly improve the condition. This is a very common sign, but is most often overlooked. Mild edema in the legs and ankles. Kidney edema usually appears at the end of the day, reduces in the morning, recurs frequently. Mechanism: the kidneys have a reduced ability to excrete salt and water. Excess fluid accumulates in the lower parts of the body. Mild but persistent edema is not a normal sign of old age. Foamy urine. Signs to watch out for: thick foam, slow to dissipate, frequent occurrence. This is a manifestation of protein leaking through the glomeruli, one of the earliest warning signs of diabetic kidney disease. 5. Why are older people with diabetes at higher risk? In older adults, the number of glomeruli naturally decreases with age. Blood vessels are less elastic. They are often accompanied by underlying conditions such as high blood pressure, dyslipidemia, cardiovascular disease. In this context, just severe blood sugar fluctuations, unstable blood sugar control. The kidneys will be the first and most severely damaged organ. Diabetic kidney disease does not come on suddenly, does not cause loud pain, but progresses slowly, deeply, and is very difficult to reverse. Understanding the role of the kidneys, the mechanisms of damage, and early signs is key to protecting the kidneys and ensuring long-term quality of life. 2. Take concrete action. First, control blood sugar correctly, not just a nice number on the meter. Many people with diabetes, especially older adults, completely misunderstand blood sugar control. They think that just one normal blood sugar reading, or several consecutive days of nice numbers, means the disease is under control, and they may even neglect medication and lifestyle. This is the most dangerous mistake, leading to silent kidney damage. The real problem isn't a single number. The kidneys aren't destroyed by a single spike in blood sugar, but by constantly fluctuating blood sugar levels, high and low levels, unstable blood sugar levels from day to day. Each time blood sugar spikes, glomerular filtration pressure increases, capillaries are stretched, vacuum walls suffer microscopic damage. When blood sugar drops too quickly, blood flow to the kidneys decreases. Kidney cells lack oxygen. The recovery process is interrupted. This repeated daily fluctuation is the silent killer of the kidneys. True control means stability, sustainability, long-term, not one perfect measurement, 1 week of strict dieting, 1 course of regular medication, but rather minimal blood sugar fluctuations between morning, noon, and night, minimal differences between days, maintaining it for many months, many years. 3 core things people with diabetes must do. Things: 1. Monitor blood sugar regularly, at the same time each day. Measuring at the same time each day helps. Accurate comparisons. Detect subtle upward trends. Random measurements do not reflect the true condition of the kidneys. Things: 2. Absolutely do not reduce or stop medication on your own. Many people see their blood sugar as stable, reduce the dose themselves, or take it every other day. Consequences: blood sugar fluctuates sharply. Kidneys suffer more damage than when blood sugar is continuously high. Things: 3. Report to your doctor if there is a difference between morning and night blood sugar. Large. A difference of greater than 3 to 4 millimoles per liter indicates Suboptimal treatment. Kidneys under pressure. Early adjustment equals protection of viable glomeruli. Secondly, diabetes treatment must be linked to kidney protection, a fact that very few people are told. Not all diabetes medications protect the kidneys equally. Diabetes doesn't kill the kidneys directly. It kills them through incorrect treatment. There are medications that only lower blood sugar, but don't reduce glomerular pressure, don't protect renal capillaries, and don't prevent fibrosis. If you only focus on looking good while neglecting the kidneys, blood sugar is stable, but the kidneys will still gradually deteriorate. Some groups of medications are beneficial for the kidneys. In principle, modern medications can reduce glomerular filtration pressure, reduce protein leakage into the urine, slow down inflammation and fibrosis of kidney tissue. The important thing is not the name of the drug, but the principle of treatment selection. The golden rule: treating diabetes equals long-term kidney protection, not waiting until the kidneys are weak before worrying, or waiting until proteinuria appears before treating, but protecting the kidneys even before symptoms appear. Adjusting the treatment regimen when there is foamy urine, there is mild edema, where the microalbuminuria index is slightly elevated. Each glomerulus lost is lost permanently. 3. Small habits, but they determine kidney lifespan. This section is extremely important because viewers can implement these immediately after watching the video. Habit 1. Eat less salt, but the right way. Many people misunderstand. Just reducing salt is enough. The reality: high salt water retention, increased blood pressure, increased glomerular pressure. Eating less salt helps reduce the filtering burden on the kidneys. More stable blood pressure, less fluctuating blood sugar. Important: not extreme salt intake, but a gradual reduction, long-term maintenance. Habit 2. Drink water regularly. Don't wait until thirsty. Common mistakes: avoiding drinking because of fear of frequent urination, or drinking a lot at once. Both harm the kidneys. Drinking water correctly helps stable blood flow through the kidneys, prevents waste products from concentrating, reduces microscopic damage to the glomeruli. Principle: drink evenly throughout the day. Don't drink all at once. Don't wait until thirsty to drink. Habit 3. Monitoring kidney problems. Don't wait until pain to worry. Kidney problems don't just signal pain. Signs to watch out for: mild swelling in the legs and ankles, foamy urine that takes a long time to dissipate, persistent fatigue even with rest. This is no small matter. This is the golden time to save the remaining kidney. Early detection, timely intervention, slows progression for many years. Avoid dialysis later. Diabetes doesn't cause kidney failure in a day, but every day your blood sugar fluctuates. Every time you're careless, your kidneys are losing one glomerulus at a time, silently and irreversibly. Don't wait until your kidneys speak up. Don't wait until you need dialysis to regret it. Proper blood sugar control, protecting your kidneys early, is the way to maintain your health and vitality. Life expectancy in old age. Thank you for taking the time to watch today's video on the Elderly Health channel. If you found this video helpful, please like, subscribe to the channel, and share it with your loved ones who have diabetes, because you might be helping them avoid kidney failure in the future. Wishing you good health and peace, and see you again in the next health videos.